Hello, and welcome to today's online learning activity, Care of a Dying Client, providing end-of-life comfort with regards to cancer pain management. This online learning activity is brought to you by Doug Beamer, Heath Curry, and Paul Johnston. Today's online learning objectives: understanding the nurse's role in end-of-life comfort. We will examine ways of assessing cancer pain in the last days. We will discuss basic guidelines for pain management for a dying cancer client, as well as discuss barriers to overcome regarding pain medication. Today's goals: the nurse will have a better understanding of pain symptom management to allow a person to live and die with dignity. Pain and symptom management. It is a nursing responsibility to provide effective symptom and pain management in order to allow patients to live with dignity. Therefore, the use of appropriate pain management is a critical component of end-of-life care, which is a common concern expressed by dying patients, a fear that they will experience pain and suffering. Although increasing doses of pain medication may, in very limited instances, have a secondary and unintended effect of hastening death, this action is ethically justifiable if the dose of pain medication is adjusted appropriately and the primary intent is to relieve pain. Pain assessment. Prior to treatment, an accurate assessment needs to be completed in order to determine the cause, type, and severity of the pain and its impact. A comprehensive assessment of pain should include physical effects or manifestations of pain, functional effects, how does it interfere with ADLs, spiritual aspects, as well as psychosocial factors. Self-assessment pain scales should be used by clients with cognitive impairment. Pain assessment using the acronym OPQRSTUNV. This just expands on the typical PQRST pain scale, pain model there that we are all familiar with. So I'll just run through this real quick. O is onset. When did it begin? P is provoke. What brings it on? What makes it worse? What makes it better? Quality. What does it feel like? Can you describe it? Region. Where is it? Where does it spread? Severity. This is the pain scale, 0 to 10, 10 being the worst pain experienced. T is treatment. What medications or treatments are you currently using? Are these effective? Is there any side effects? All of those kinds of things. U is understanding. What do you believe is causing your symptoms? V is values. This is important. What are your goals for the pain? What are the comfort goals? What are the acceptable levels of pain? And of course, the most reliable source of pain is the client's self-report. The Edmonton Symptom Assessment System, or ESAS, is a valid and reliable assessment tool to assist in the assessment of 9 common symptoms experienced by cancer patients. The ESAS is one of the key assessment tools used in the Palliative Care Integration Project. The original tool was developed by the Regional Palliative Care Program, Capital Health in Edmonton, Alberta. The purpose of the ESAS was designed to assist in the assessment of pain, tiredness, nausea, depression, anxiety, drowsiness, appetite, well-being, and shortness of breath. One blank scale is available for patients to use to assess other problems as needed. The severity at the time of assessment of each symptom is rated from 0 to 10 on a numerical scale, with 0 meaning that the symptom is absent, and 10 that it is the worst possible severity. How to use the ESAS. The patient circles the most appropriate number to indicate where the symptom is between two extremes. So as we can see here, we have 0 being no pain to 10 being the worst possible pain. And some things to keep in mind with regards to this. Some words may be difficult for some of the patients to understand, and we've just included them in that table below there for your own review. So guidelines for treatment of pain. Provide education to the client and family about the use of opioids. Anticipate any adverse effects such as constipation. Start low and slow for opioid-naive clients and increase as necessary. Give opioids around the clock in order to maintain a therapeutic effect, as well as provide PRN breakthrough medication as required. So pain control using a pharmacological medication. The use of pharmacological medications to treat cancer pain is a nursing responsibility that requires a comprehensive and aggressive approach. The types of analgesics used to treat pain include anti-inflammatory drugs, opioids, co-analgesics, and acetaminophen. The World Health Organization's pain ladder. The WHO is responsible for a 3-step process for pain management. So basically it starts off with the use of a non-steroidal anti-inflammatory medication, and you work up the ladder to codeine, morphine, fentanyl, etc. So according to Potter and Perry, when a patient with cancer first experiences pain, it is recommended to begin with a higher dose than will be needed for continual pain relief, and then slowly decrease the amount as necessary. So barriers to using opioids for pain relief. There are tons out there, so we'll just quickly touch on a few key points here. Barriers that the client may have. They could believe that the physician has more important or ill clients to see, or that they believe that suffering in silence is noble. They could have inadequate education, as well as they could also be worried about the possible side effects for the medications too as well. So some of the barriers for the healthcare provider is an opioid phobia for whatever reasons. They could also fear that giving a dose will kill a client, or fear of legal repercussions. Or they may also believe that opioids may mask the symptoms that the client may be experiencing. So some of the barriers for the healthcare system, of course, is extensive documentation, poor understanding, lack of resources, and inability to fill prescriptions. So ways the nurse can break through these barriers. It is a nursing responsibility to educate themselves regarding the use of pain medication in order to provide relief to a dying client. It's also important to educate the client and the family about the importance of pain medication during the dying process. Another way to break through the barrier is talk to the prescribing physician about more scheduled medications and less PR medications so that the therapeutic effect is maintained. And be fully aware of your client's condition and advocate accordingly to their pain needs. This online learning modular was presented by Fanshawe College nursing students, Doug Beamer, Heath Curry, and Paul Johnston. Now we've moved on to the review questions. Please feel free to pause this video and answer the questions, and unpause when you'd like to see the answers. If you'd like to receive more information on today's topic, please feel free to check out these recommended websites.